media queue, and if there's others on the line, please let me know following, okay?
Hello. Good morning. Thank you everyone for joining us. We're just getting all the technical details in place. We have a call-in line today. Thank you for your patience. I'd like to thank everyone for joining us today for the update on COVID-19. We have the Minister of Health, Pauline, as well as the Chief Medical Officer of Health, Dr. Brendan Hanley, here to provide some up-to-date information and take some questions. We also, for the deaf and hard of hearing, have an American Sign Language interpreter, Mary Thiessen, who's beside me. I'd just like to remind everyone asking questions today to speak at a slower pace so that we have time to interpret. We're also live streaming this on Facebook, and there is closed captioning available as well. Before handing it over to Minister Frost, I'd just like to thank all of our media partners, including CBC and Shone FM, who are broadcasting this live on radio to Yukon communities. We understand that not everyone in the Yukon has access to the internet, where a lot of the up-to-date information is available, and we appreciate all of the efforts everyone is taking to disseminate the information to all Yukoners who need it. Without further ado, I'd like to invite Minister Frost up to make a statement. Thank you.
Good morning. Thank you for joining us today on an update on COVID-19 in Yukon. We are fortunate there are still no positive cases of COVID-19 in the Yukon. I want to thank all Yukoners for their diligent efforts to help flatten the curve during this critical time. We know that the first case of COVID-19 in the territory is only a matter of time. We are taking all the steps necessary to ensure that we can prevent the spread of the disease. We are setting up a respiratory assessment center in Whitehorse to help treat individuals with acute respiratory illness such as influenza or COVID-19. The center will be located at the Yukon Convention Center on 4th Avenue and will open in the coming days. By diverting individuals who have flu-like symptoms to the assessment center, we are taking pressures off of the hospitals, physician clinics, and Yukon Communicable Disease Control Center. Additionally, we are prepared to use the Coast High Country Inn as an isolation center when needed. This space will be used for individuals returning to Yukon who have to self-isolate and are unable to return home because their home situation does not allow for proper isolation. An example might be someone who is coming home to a rural community from the United States or abroad and has to self-isolate. Their home may not have 2 separate bathrooms, for example, which is recommended for isolation, or there may be someone in their home with health conditions who should not be exposed to any possible illness. There may be other options from their community. We will work with communities to identify appropriate places for self-isolation as we get cases. Whether someone is from Whitehorse or from another community, we will help those returning individuals protect their families and their friends. Using the hotel allows us to separate individuals who may need accommodations, such as additional healthcare workers who have come from other jurisdictions to assist. I want to thank the Northern Vision Development for working with our government and allowing us to use these spaces to address the current situation. We all need to work together to ensure Yukon remains prepared for COVID-19 and can manage the situation as it develops. The community-minded spirit we are witnessing from individuals and businesses across the territory is truly inspiring. As we know, this situation is changing rapidly. Earlier this week, we launched a new online assessment tool to help Yukoners assess important health information within minutes. This tool is available in English and French, and we encourage Yukoners to use it before calling 811 if they are able. Later today, individuals who do call 811 will find a new triage system in place. Working with our partners at Northwest Health, we have been able to find a way to increase local capacity and provide more Yukon-specific information. This will help alleviate wait times for Yukoners. As I am sure you can appreciate, there are lots of people across the government working tirelessly on response to COVID-19. I want to take a moment to just thank the doctors, the nurses, the healthcare professionals, the frontline staff, as well as those working behind the scenes to mobilize efforts throughout the territory to protect the health and safety of Yukoners. Together we can get through this situation. Together we will once again be able to gather for spring carnivals and bike relays and paddle the Yukon River Quest to Dawson City. By acting now, as Wade, I have seen so many Yukoners do, we will get back to a time when we can hug friends that we see on the streets, or friends we see in our communities. In the meantime, we remain committed to keeping all Yukoners updated with new information as soon as it is available. With that, I would like now to ask Dr. Hanley to provide some latest public information updates. Thank you.
Thank you, Minister Frost. We're still in a good position. Preparations are ongoing. And at the same time, we're living in unprecedented times. We are in a time of intense preparation. Social distancing, protecting our vulnerable citizens, while optimizing healthcare capacity and our ability to meet population needs. So preparation ranges from helping to support elders in rural supported housing to supporting government and private business to carry on as best as possible, to bed management and ventilator training for nurses and GPs, to amplifying public health nurses to manage and contain cases, should cases arrive. But we are not in lockdown. Society needs to function as well as possible under these new measures and constraints. This is a time of adaptation and preparation, but not of shutting down.
Nous sommes dans une période de préparation intense. Distance sociale, protection de nos citoyens vulnérables et améliorer notre capacité de soins, de santé, de la capacité de répondre aux besoins de la population. Si c'est soutien des aînés dans les logements appuyés, si c'est soutien des entreprises publiques et privées pour continuer de faire des commerces le mieux possible, aux gestions des lits à l'hôpital, la formation du personnel pour gérer des ventilateurs, l'amplification des infirmières dans le secteur santé publique pour gérer et contenir des cas. Mais nous continuons. La société doit fonctionner au mieux sous ces nouvelles mesures. C'est un temps d'adaptation et de préparer, mais ce n'est pas une fermeture. In this vein, there are a few additional measures being put in place, apart from what the Minister has announced. One is about hospital visits. So Whitehorse General Hospital has, after due consideration, decided to suspend all scheduled non-urgent surgical procedures as of Monday, March 23rd. It's important to note they'll continue to provide surgical care for urgent and emergency cases. Anyone with an appointment will be contacted individually by the hospital to let them know and to help them with questions. Yukoners may also be already aware that no visitors are allowed at the 3 hospitals in the territory, apart from the limited exceptions that we've already published. Now active screening is in place at all hospitals, and that active screening is about asking anyone come to the hospital the reason for the visit, symptoms, and travel history. On childcare programs, I know there were many questions about daycare and what was the decision about daycare after our announcement about suspending classes, school classes. Daycares and childcare centers will not be closing, and there are a number of reasons for that, which I can go into later. But the gist of the reasons is that daycares are very, very different settings from schools. And we've been very actively working with daycare operators, Family and Children's Services branch, as well, to ensure that we have a really careful and measured approach to childcare centers. Certainly, childcare and safety is an utmost priority for all of us. Reducing the number of children attending childcare centers has already been recommended, and this has actually happened, and this has helped to limit the potential spread of virus should virus arrive in the community. But we recognize that not all parents are able to look after their children at home at this time. So truly childcare services are a way to continue to offer essential services for parents, for society in this situation. It allows care for children who continue to need care. It also allows essential services to continue. Regarding the respiratory assessment center that the minister has announced, I'm very pleased that I've been quite involved in this process to help make sure that all the right links are being put in place to ensure that when this opens, that it opens with ready to welcome the people that need to be there and to provide a good service, recognizing that this has been set up from 0 to opening in a matter of days. I think the biggest message I want to give about this is that it's not a walk-in, it won't be a walk-in facility, it's a phone-first facility. And this is really to try to line up with the way that we would like to do care now. So phone advice will be available and we'll be able to give more precise details closer to that because we're actively working on the 811 service to make sure that the right direction and the right advice is being provided. Basically, the respiratory assessment clinic is being set up for people who have flu-like illness, have respiratory illness, who, upon phone triage, are advised to get direct medical assistance. So, as I've mentioned on many occasions, there are many people with flu-like illness who don't need to be seen at all. In fact, the majority don't need to be seen at all. They can, whether we're in a time of COVID or not, influenza-like illness is mostly mild, and people don't need to be seen. The people that we would like to test, the people that we would like to be assessed, are 2 general categories. Those who, on using the assessment tool, the online assessment tool, or by phone triage, are recommended to get testing. And basically, again, that's people with respiratory symptoms associated with a travel history. And those are people that we would like to test for COVID, and then to be able to advise accordingly. The second category is those with influenza illness who are at risk for complications or who have serious illness. Of course, those with serious illness, we want to be seen at the right place for serious illness, which is the emergency departments or the community health centers. And the emergency departments and the health centers continue to be completely available for people with serious illness, whether it's influenza-like illness, whether it's COVID, or whether it's anything else. The intent of the respiratory assessment clinic, though, is to divert low-risk people with these kinds of symptoms, with influenza-like symptoms, to a centralized area to be able to be seen for those who need to be seen. Je vais ajouter quelques mots en français. Pour ça, nous sommes très heureux que la clinique respiratoire soit mise en place si rapidement. C'était vraiment un effort conjoint entre mon bureau, le centre de maladies communicales, la communauté médicale, le département de santé et des services sociaux et l'hôpital. Et c'est un moyen de fournir un lieu centralisé pour évaluer les patients atteints des symptômes respiratoires qui a besoin de l'aide médicale, y compris les personnes présentant des symptômes qui peuvent avoir des COVID. C'est pour les patients avec des maladies, une maladie qui est pas grave. Donc, il y a toujours les salles d'urgence ou les centres de santé qui restent disponibles pour les personnes ayant des maladies sévères, soit de maladies respiratoires, soit de n'importe maladie. Le message principal, c'est téléphone d'abord, avant d'aller au centre respiratoire. Donc, on veut bien qu'une personne ait conseillé de visiter le centre par téléphone. Donc, c'est pas une clinique ambulatoire sans rendez-vous. And I'd just like to talk about a little bit more about the hospital closure, and then I think we can close or open for questions. And the hospital closure of elective procedures. So closing elective procedures, but allowing emergency procedures, urgent procedures, and those other procedures that are considered non-elective, whether that be emergency surgery, trauma surgery, cancer surgery, those kind of things will very much be continuing. But it's the things that can be put off for a while that are triaged to be elective, where people can wait without undue convenience. Those are the people that will be asked to reschedule for a later time. Now there are two fundamental reasons behind this. One is on the social distancing, the measures that we're, again, asking all the public to start observing. So it's really to try to limit the flow of people into the hospital in line with other social distancing measures. So let's bring people into hospital that it's more urgent to see, who need to be seen, but if it's not that urgent, maybe we can put that off and limit that kind of flow. The other reason is to allow a concentration, again, in the line of preparation, allow a concentration on getting ready for contingencies, getting ready for surges, and making sure that the healthcare personnel are well prepared, are practiced, and have that capacity to ramp up according to demand. I think I've spoken for a while. I think we can take questions at this point.
Thank you, Dr. Hanley and Minister Frost. So we have a number of people here in person. We also have a few people joining us on teleconference. So after we do a round of questions for those in attendance, we'll go to the phone and then circle back. We have a microphone just over here, so if those in attendance could line up, we'll take questions one at a time.
Thanks. Hi, Tim Kacharik from CKRW. Just a question for Dr. Hanley. Can you give us testing numbers updates on how many have gone out, how many come in? Maybe I'm also interested to know how many are like going out per day now. And as of the when we spoke last time, you had said BC was looking to ramp up their testing and output early next week. Is that still on track?
The best advice about testing numbers is to look online. And I can tell you that I am not actively following testing numbers, but I refer to online. We are encouraging testing, continuing to encourage testing according to criteria, even as the criteria might change from week to week about who we should be testing. The last time that I looked online, I think it was just over 100, maybe 101 as of yesterday. We're going to give summaries by week because the day-to-day flow varies significantly. And that depends on the number of people tested, it depends on the transport, and it depends on how tests might be batched at BC-CDC. So we had a large number of tests coming back late in the week, all negative. The backlog has been largely fixed, and so we are expecting much faster turnaround times as of now. There is still a backlog from the tests that were done a week ago because the changes in automation that were required were only put in place for the more recent tests that was earlier this week. So there's almost like two bundles of tests. There are the ones that, although we've gotten most of them now, there's still a few that were in that kind of backlog from last week. But the ones that are being sent now are coming back a lot more quickly. What is a lot more quickly? The best is 2 days, and the slowest might be 3 to 5 days. So we are continuing to, obviously, we are all interested in rapid turnaround times, but we are, again, all interested in quality lab tests that are reliable and the information systems to go along with that. Every person who has a test result, whether it's negative or positive, is contacted and counseled accordingly. So I'm very happy with the speeding up of testing changes. Did that answer all your questions?
And then the BC capacity, I guess, yeah, you answered that. So. Okay, so where's the website?
So good question. Yes. So I always go to yukon.ca. That's simplest to say, yukon.ca, and then the first thing you see on yukon.ca is the coronavirus section, and posted right on that front page of the coronavirus section is the number of tests that have been done. As I say, that's going to be updated weekly, and then the number of positives, which is at 0. And that would be a change that we would change according to the count that we have. In other words, we wouldn't batch that weekly. We would do that daily as possible.
I was hoping to get more clarity on how long it takes to get test results back and that kind of thing, because I spoke with somebody who said that they were told it could take up to 2 weeks to get their results back. So can you kind of clarify how long exactly it has taken? Like, what was the very maximum amount of time it's taken so far? Is it still within those 3 to 5 days? And what can you kind of clarify further why it's taking so long, and if the territory has shopped around to see if this testing could be done quicker at another location, for example?
So the best way to explain that is that there have been, what happened was in BC, our testing is in BC, our testing is at BC CDC lab, and That is a lab that we've had a connection with for many, many years. So yes, of course, the first thing, if tests are coming back slowly, one of the first things is to say, okay, what are the alternatives? But we have a very special relationship with BC CDC labs, and it's very important for, as I've mentioned, in other places or other recent conferences, that testing northern communities is actually a priority for Canada. So we likewise have a special relationship where BC recognizes that Yukon tests are very important, and that has helped to kind of. But the main improvement has actually been on automation. What happened was that there was a very rapid demand last week in BC for testing. Testing increased significantly in a short time. Probably about a 1 week lag for lab testing capacity in general in BC to ramp up, and that included establishing testing at other sites around. We're able to absorb the test load. The load on BC CDC has decreased at the same time that this week we've had always going to be varied, but our working principle is 3 to 5 days.
Mathieu Servet de Radio-Canada, peut-être en français, Monsieur Hanley, peut-être juste donner un peu plus d'informations par rapport au laboratoire en Colombie-Britannique, combien il y en a et c'est quoi leur capacité, combien de tests ils peuvent prendre et analyser combien de temps ça prend et combien ils peuvent en recevoir par jour.
Donc, la question sur le nombre de tests et comment on peut percevoir le nombre de tests. Donc, peut-être je vais répéter plus ou moins ce que j'ai dit en anglais et puis ajouter un peu. Donc, le laboratoire, il y a une grande capacité pour nous d'avoir le laboratoire du Centre de contrôle de maladies à Colombie-Britannique. Donc, c'est un laboratoire central pour la province. So, capacité, ce n'est pas vraiment un problème pour nous, selon le nombre de notre population. Mais le processus, c'est d'envoyer les tests d'ici, là-bas, avec un délai entre 3 et 5 jours total. Donc, on a beaucoup amélioré le process pour avoir les résultats dans un temps plus efficace. Pour voir combien de résultats on publie par semaine, et les résultats c'est sur le site web de yukon.ca.
De ce que je comprends, il y a quand même eu un engorgement là, avec le nombre de tests qu'ils ont reçus dans les derniers jours. Est-ce qu'il y a un seuil à partir duquel là, les temps peuvent être prolongés, puis ça peut prendre plus de temps pour les gens ici d'avoir leurs résultats?
Je n'ai pas tout à fait compris la question.
Il y a eu un ralentissement quand même dans les derniers jours, comme vous le soulignez. Est-ce qu'il y a un seuil au-delà duquel ils ne peuvent pas fournir assez rapidement les résultats pour vous, pour le Yukon?
On continue de travailler avec le laboratoire, on va voir. C'est toujours un travail avec un système de transport. Donc, le seuil ne peut pas peut-être aller plus long que le temps de transport. Et puis, il y a quand même des contraintes. Mais d'avoir un résultat qui vient avec un temps de 3, même 5 jours, c'est beaucoup plus efficace que nous avions. Et c'est un temps normal pour beaucoup d'autres tests. Et ça fait qu'on peut mettre en place ça sera beaucoup plus facile pour les personnes qui sont en attente pour les tests. On continue de suivre très proche
pour maximer, pour avoir le moins de temps possible. Et donc, on continue à suivre.
Hey Brendan, it's Julian from Yukon News. I have 2 questions for you. One has to do with non-urgent procedures being suspended. Can you give us some examples of those? And then my other question has to do with the respiratory center. I'm just wondering, if someone like me wants to get tested there, what procedures do I need to go through in order to get tested there?
The first question about suspending non-essential hospital services or non-urgent hospital services. First is emergency surgeries will always go ahead. Cancer surgeries, things like urgent endoscopies will proceed with appropriate screening for travel history and symptoms. So if someone, for instance, has cancer surgery booked, but they're sick with an acute respiratory illness, they would be rescheduled until they're not until they're beyond their acute symptoms. Other examples: minor procedures that would be safe for skin cancers would go ahead, but other minor procedures that are not as urgent, other minor procedures would be delayed. Time-sensitive obstetrics procedures, gynecology procedures would be still going ahead. There may be other cases, for instance, a gallbladder removal, which if people were not having complications with it or recurring bouts of inflammation, they will be postponed. But if people are having recurring issues, they would be scheduled with the appropriate screening criteria. So those are a few examples. The second question was about how do you actually get into the ILI clinic, and this will be more clear prior to opening. So the communications around it are actually being prepared as we speak. What the ideal way would be through the 811 line, so that if you are advised. The 811 line will always try to screen out, of course. The first question is, do you need to go to the emergency? And again, if it's a severe influenza, whether it's possibly COVID or not, if you have severe symptoms, the place to be seen is the emergency department. In the rural context, that would be the community health center as the first point. So they will tell you to do that. So if that part is screened out, then it's a question of whereas screening in to see the respiratory assessment clinic, there's going to be a bit of there are some that will need, and it gets a little bit complex because there are some that are being followed by public health, where, for instance, they may be a contact of someone with COVID and they are positive. They will continue to need to be seen by communicable disease control, by YCDC. So there's always going to be a flow to Yukon Communicable Disease Control. But those who are, say, phoned in and they are advised to be tested for COVID and they're well, or they have flu and need to be seen, they will be then advised to go through to see the ILI clinic. So for instance, if you had the flu, you had something that was a trigger that you couldn't just stay at home and get better. You had flu-like illness, but let's say you were concerned that things were getting worse and you wanted to be seen by a physician, you phone, and then you get screened into the ILI clinic or the Respiratory Assessment Center.
Just a follow-up to that, I mean, how long would that take getting screened in? How long would people wait to get tested after that point?
Oh, it's going to be set up at daytime hours. The exact hours will be published. But so, for instance, if you were phoning during that day, phoning in the morning, you would ideally be given a time or told to drop by. It really depends on, we're going to refine the process as we go. The key point at this moment is centralizing that service into one place.
So you might either be told just come by, or you might be given a time to come by. If you were phoning the evening before and you were fine and there were no signals that you should be seen urgently, then you would be advised the next day to either phone again the next day or to go at a certain time the next day.
Hi, Gabrielle with the Star. I just wanted some clarification on the changes to 811. I see it says that you can be directed to Public Health Agency of Canada or YCDC, and I'm just wondering what that looks like as a caller, and then if there are other changes to the line as well.
So this again is a kind of a change in process that's occurring more or less as we speak. So what we're hoping to have is a more direct access to Yukon specific information kind of at the front end of 811. 811 is still the best place to call for the right advice for all kinds of medical questions. And will continue to be so. But what we're trying to build into the front end is a way to stream out those who are concerned about COVID, who are wondering whether they should be screened for COVID, or who have questions about, influenza-like illness, or should they be seen because of influenza-like illness. So that again, we'll be able to give more details once that's sort of up and running and fixed. But again, to point to the self-assessment tool, it works. It's really good, and it helps to triage you through that. Okay, do I actually need to be seen at all? Do I need to go to emergency? Do I need to be tested for COVID? So that's kind of built into the self-assessment tool. Very quick and very easy to use.
Thanks. We'll now go to the reporters we have on our teleconference line, and we'll start with Beth from the Canadian Press.
Matthew, Beth has actually gone off the line, so we can go to the next caller.
Okay, Kevin with Media Q. Okay, it sounds like our callers have left the line. I know Tim Kaczmarek had another question. Do you want to come to the mic, Tim?
Just a little bit more on the respiratory center, and probably a question for both. Dr. Hanley, when do you expect it to open? I haven't seen anything indicating when it would open. And then from the Minister Frost's perspective, the release yesterday indicated that, from what I read, that NVD was donating the space. Like, can you clarify? Like, are you renting it, or is it being donated at 100%, or can you elaborate on that?
Thank you. Let's say that why it wasn't announced earlier. Clearly, we had to work out the arrangement with NVD, and in regards to how that arrangement was how it transpired is. Certainly we needed to find a secure place in the city, and they stepped up to offer their facility at cost. So they're not really making any money on the arrangement. They've stepped forward to give us the facility at cost. Thank you.
So I'll give the follow-up question to Tim. We didn't put a date because we're actively setting up. We're hoping for early next week, and we will confirm as soon as we know that we're ready. Well, of course, we want to make sure all is ready to go, and then we'll let people know. But early next week is our aim.
Can you further explain, please, why daycares are still allowed to be open? Like, I'm imagining a bunch of kids in a room putting Lego in their mouths, etc. Like, is that safe?
Putting Lego in their mouths is never the safest thing. So, again, I want to stress that we are still in a time of preparation, and we're not in a time of lockdown. So we're always in a time that we're considering our next steps and our thresholds for the next steps. And as I said before, whether it's kind of a healthcare decision, like pulling back elective procedures, or a social measure, like limiting people's ability to mingle, it has consequences. So child care services are an essential service, and we have been working individually with and will continue to ensure that the best measures are put in place, such as cleaning frequency, such as thinning out the child care centers, for instance, so they have less kids in any one space. So of course, you cannot ask children to stay 2 meters apart, but you have other social distancing measures in place. So we are again allowing a balance between society being to continue in a time that we're confident that this is a safe way to manage children, and to allow people to carry on with providing essential services while having their children safely cared for.
But like compared to a school environment where you can separate kids by desks, for example, different recess periods, etc. Like, can you just kind of further explain how like schools have been kind of shut down to some degree, but daycares aren't?
Schools are suspended to allow measures to continue. The thing is, the purpose of schools is different from the purpose for childcare. So we're really talking about two completely different sets of assumptions about what the needs are. So that's why we're treating them separately. So, for instance, you can actually do what kids need, school kids need, to a large extent virtually. So the more that you can put in place either social distancing measures on site with kids who actually can follow instructions and be spaced, or allow for more virtual education opportunities, you're talking about a different environment and a different response to their needs. So that the needs are different, and the environment is very different, and the risk assessment is very different. So again, it's a different way of balancing the risks of discontinuing something with the risks of continuing something. And always that risk equation changes and might change as we get to different stages, either of preparation or of COVID in the community.
We have a member of Yukon's Deaf and Hard of Hearing community who would like to ask a question through the interpreter, so we'll take that now, please.
Hello, I really want to thank you for the process and letting us know. I really want to thank you for letting us know about what is going on, and I'm really impressed in that you've provided an interpreter here. And I do have a question. And you know, if something happens and we call the 811, how would the deaf and hard of hearing people contact through the system? Is it accessible through the text? I don't think it's available here for the deaf and hard of hearing. And how would that happen? How do we contact 811?
Thank you for the question, and it's not a question I can answer right away. What I can do is make sure that question is answered, and what I would also say is that the online, of course, there is the online self-assessment tool for particular concern about influenza-like illness or COVID. So that in itself will answer a lot of questions, as well as the other information on the website. So that's certainly one immediate resource. The other points are well taken, and we will get back to you on that.
Good, thank you. Good, thank you very much.
Just one quick response. I know that things are rapidly evolving, and we are trying to provide as much support as possible. So thank you so much for making that known to us. I would suggest at this moment in time, what we have set up is an email line as well, which is COVID-19info@gov.yk.ca. It's easier for us who don't have difficulties hearing to go to other means, but I would suggest you use that line method of communication, and in the meanwhile, we'll work out some solutions for you. So thank you so much for your patience.
Monsieur Hanley, juste une dernière question. Pour revenir à la clinique, peut-être juste mentionner la capacité, le nombre de médecins, d'infirmiers, de lits, quelle va être la capacité?
C'est vraiment en cours de préparation, donc c'est difficile de dire le nombre de médecins. On a un médecin sur place, un autre disponible selon demande, par exemple, et on aura plusieurs de personnel pour appuyer. On va avoir un infirmier avec de l'expertise, d'expérience dans la santé publique. Et aussi un infirmière ou assistante infirmière ou deux ou trois pour aider avec le triage et pour l'information, pour assurer les patients qui ont besoin d'informations. Et donc, tous les détails vont venir bientôt.
Thank you very much. That's going to conclude our update for today. If media have follow-up questions, please just wait as we finish this and I can follow up with you directly. There will be more updates in the coming days and weeks, and the most up-to-date information is available at yukon.ca, as you heard, so please stay tuned to that. Thank you very much for joining us.